So, hope I'm audible.
Yes, ma'am.
Yeah, okay. So, can I start now? Yeah,
Yes.
yeah, okay. So, before starting, let me introduce myself. I'm Dr. Bhargavi Venkatesalu. Did my undergraduation from SRM Dental College and Hospitals, and I'm a gold medalist from my in my post graduation from the Department of Oral and Maxillofacial Pathology and Oral Microbiology from Meenakshi Ammal Dental College and Hospitals. So, I'll be handling general histology and your microanatomy. So without further delay, let's just start with the topics. Okay. So the first chapter here is your epithelial tissues. Okay. So what you're going to study is your histology. So basically, to give a basic introduction, histology is nothing but study of tissues. Okay. Through a microscope. So like be it your human body or plant tissues, some study of tissue under the microscope is your histology. Okay. So the first chapter here is your epithelial tissues. Okay. So why is epithelial tissues? Because you take any cavities in the body, be it any organ of the human body, everything is going to first start off with your epithelial tissues. Okay. So be it any infection or injury or even any scalpels during surgery, the first step that you're going to counteract is your epithelial tissues. So it is, you have to identify the epithelial tissues and then you can further proceed. Okay. So under epithelial tissue, we'll be seeing about simple epithelium, pseudostratified epithelium, and compound epithelium. We'll be seeing each in detail. So yeah, as I said, in the first slide, as I said, the one of the so epithelial tissues are one of the most studied types of tissue in the human body that lines most of its cavities. Yeah, as I said. So the epithelials are the first studied and the most studied types of tissue, and it lines. So be it anything, it is the first line that you're going to see, followed by which you'll have connective tissue and other organs. Okay. So what are all the basic characteristics? So for an epithelial cells to possess, what are all these epithelial cells? So they are basically cells. Okay. Yeah, they are basically cells. These are jam-packed epithelial cells that are arranged in layers, various layers. Okay, so it covers the body surfaces. Yeah, it is going to cover your entire cavity or your body surfaces, and they are going to protect your body surfaces. And it has two surfaces, that is your free and your basal surface. I'll talk about that in the upcoming slides. And they also have specialized cell contacts. Yeah, I'll explain that in the next slide. And they are avascular, meaning the epithelial cells have no blood supply or any nerve supply. They just get their nutrition supply through some passive diffusion. Okay, so they do not have any blood supply or a nerve supply, and they undergo mitosis. See, any cell of that matter is going to take place cell turnover rate. Okay, it divides the basal layer in the below layer, it goes and it as it divides, it reaches the topmost layer and it starts shedding. So that is your cell turnover rate. So it undergoes mitosis in that type. So what are all the basic functions? Protection. So as I said, they act as a physical barrier between the what do we call between your organ or the cavity it lines. It's going to act as a physical barrier between that and any sort of internal stimuli or any physical damage or a chemical damage. It's like, say for example, if there is any infection or any injury, your epithelium is going to act as a physical barrier between the stimuli and the underlying connective tissue and other parts of the body. Okay, so that is your protection part. Next is your absorption. So for example, if you take your intestinal epithelium, when your digested food products pass through the intestine, yeah, it's very obvious your vitamins and minerals that's been passing through, it's going to get absorbed. And then your waste products will be excreted, right? So those absorption will be taken care of by your intestinal epithelial cells. I'm just giving intestine as an example. Okay. Next is secretion. So I'm not telling all the epithelial cells in the body are going to secrete something. It's not that. Your glandular epithelium, like your exocrine glands, your endocrine glands, be any type of glands or any apocrine glands, your hormones or any secretions, everything is going to be taken care of by your epithelial cells. Next is excretion and filtration. So for here, you can take kidney as an example. So for in kidney, where excretion, yeah, the waste products are just filtrated and excreted through kidney. All this excretion and filtration are taken care of by urothelium. That is your epithelium in the kidney. Okay, that is your urethral and your kidney epithelium. And next is sensation. Yeah. epithelial cells, I mean, epithelial layers will have certain sensory, like sensory receptors, so that they can respond to any sensations like pain, touch, temperature, and all. They just respond. So they have the sensation. So, for example, if you take corneal epithelium, you'll when you just close your eyes for a long time, and when it gets subjected to the light, obviously you're going to have some sort of sensation in terms of twitching, right? So all these happens by your corneal epithelium. Okay, so these are all the basic functions of your epithelium. Now, as I said in the previous slide, I was talking about some specialized functions, right? Specialized cell contacts. Okay, so imagine these tools are your epithelial cells. So if there is any doubt, please stop me and you can ask any questions. So these two are your epithelial cells. Okay, so the cell contact, these are your specialized cell contacts. Okay, okay, the first, there are various types like these types. I'll explain about each, and this one also. Okay, so first is your tight junctions. So what is this is, the two epithelial cells are tightly, they'll be in tight contact with each other, so that as it is in cell, there is some sort of leakage is going to be there in the matrix, like in the background, right? So to prevent that, I mean, though there is leakage, if there is any leakage from this cell, to not this cell will not take up that leakage. Okay, so that there should not be any exchange of matters between these two cells, these tight junctions are placed. And now next is your adherence junction. Adherence is nothing but your actin filaments of these two epithelial cells are going to come into contact and adhere. Like as I said, these are jam-packed epithelial cells, right? So they are going to just attach the two epithelial cells. And next is your desmosomes and hemidesmosomes. I'm talking about these two together because these are nothing but your filaments, your intermediary filaments, which are seen in your cytoskeleton here. Okay, your cytoskeletons will have filaments, right? That the cytoskeleton, what is the basic function of cytoskeleton? That is to give the structural framework of the epithelial cells. So each epithelial cell will have its own structural framework, but to join together, we are having this desmosomes and your hemidesmosomes. Okay, so this desmosomes, yeah, others intermediate filaments of neighboring cells, and hemidesmosomes, it others the intermediate filaments of these epithelial cells to the basal lamina. Okay, this basal lamina is nothing but it is just a separation between your epithelium and the underlying connective tissue. You're going to have connective tissue here. Okay, so that is your basal lamina. Your basal lamina basically separates these two. Your basal lamina itself have two parts. That is your lamina lucida and densa. Let's not dig deeper into it, but I'm just talking about the hemidesmosome. So your epithelial cell, connection of your epithelial cells to this basal lamina is your hemidesmosomes. Okay. Okay, now next is your gap junctions. Yeah. Gap junctions are channels, preformed channels to allow the flow of certain ions. Okay, like there is going to be passage of, there is going to be some sort of interchange of ions between these two cells. Okay, so that is allowed by your gap junction. So these are your specialized cell contacts between the epithelial cells, so as to allow some sort of what do we call, exchange of nutrition or through passive diffusion. Yeah. Next. Yeah, so to continue, these epithelial cells are further, as I said, simple, stratified, pseudostratified and all. These epithelial cells are further categorized according to the number of strata and the morphology of the cells. Like how many number of layers they are present and the morphology that the epithelium possesses. Okay, so the layers, depending upon the layers, it is basically three types. That is your simple, where there is only single arrangement. Like this, you'll have single arrangement of single layer of cells. The cells will be arranged in single layer. In stratification or compound, you'll have layers. Stratification meaning what? It is called as layers. The number of the layer of cells will be arranged in this manner. Stratification, like stacking up. Okay, so that is also called as a compound. And pseudo stratified. Pseudo is what? False. Okay, stratification is what? Again, layers. The cells are seen as they are arranged in layers, but that very true part is no, they are all arranged in single layer. I'll explain about each in other upcoming slides. That each category, like under the simple, stratified and pseudo stratified, you're going to have three classifications depending upon the shape. Okay, so be it simple or stratified, you're going to either have these three types of cells. It can either be simple, it can either be squamous, either can be cuboidal, or your columnar. Only these three types of cells will be seen in your epithelium. Okay, so for example, okay, before proceeding to the microscopic images, I'll just tell. See, if an textbook is given like the cell is star shaped, you cannot expect the same cut copy paste in your microscope, okay, because your tissues are undergoing n number of processes before coming in the slide. Okay, they are exposed to various chemicals and various acids, so that they are placed in one stability so that we can see the cells under the microscope. So you can just train your eyes to find the things. You cannot search the same image on the textbook, given the textbook, to be on the microscope. Okay, this is one part regarding your histology. So yeah, you can confuse your squamous with cuboidal, cuboidal with columnar. It happens. But the thing is, I'll give some certain tricks here, just in case. Okay, see, if this is your cell width, okay, and this is your cell height. Okay, if your cell width is greater than your cell height, that is your squamous epithelial cells. Okay, now coming on to your cuboidal cells. If cell height is same as that of the cell width, it is your cuboidal cells. Okay, now coming on to the columnar. If the cell height is more than your cell width, then it is your columnar. Again, under columnar, you also have tall columnar and low columnar. Let's not discuss that and all. It depends upon the size. Okay, but the three major thing is your squamous, cuboidal, and columnar. If you know about all these three, you can at least narrow down some sort of. So you can use this hack to just narrow epithelial cell type. Okay, there is one more criteria, that is your transitional epithelium. So your transitional epithelium is, imagine your bladder epithelium. Okay, so when it is in relaxed state, the cells are going to be in cuboidal. Okay, the cells will be in cuboidal. So basically, you're going to have cuboidal epithelium. When the bladder is filled with urine, yeah, it's very obvious the bladder is going to get expanded. So this happens by the cell expansion. The cells are going to expand as well. So when they expand, these cuboidal cells are transformed into your columnar cells. So that is your transitional epithelium. So just remember this concept. Okay. Next, moving on to each. So talking about the simple squamous epithelium, what are these? So these are flat cells with coin-like appearance, and their nuclei are usually oval-shaped. Yeah. See, this is your epithelium. Okay. This blue line is your basal lamina. Okay. Imagine having a connective tissue here. Okay. And this is your free surface. Because over this, you're not going to have anything. This is your free surface. This is your basal lamina. So this is your basal surface. I said in the initial slide, there are two surfaces, free surface and basal surface. So these are this, okay? And you can see here the squamous cells. These are your squamous epithelial cells. These are flat cells where the nuclei are usually oval shaped. The nuclei is not seen here. I'll show it here. This is the microscopic image, okay? Not all these are epithelial cells, not your epithelial cells. Only the elongated ones that lines the wall. This one. Okay, these are your epithelial cells. You can see the squamous epithelial cells like flat cells where you can just see the cell outline. I'm just dragging along the cell outline. You can see the cell width is more than the cell height. And you can see the nucleus here. The red laser point is your nucleus. Exactly. Okay, it is oval shape. Can you see the oval shape? Yeah. So this is your simple squamous epithelial cell. Where they are seen? Okay. See, epithelial cells, the certain type of epithelium are seen in specific areas is because they possess certain functions, okay? Not just protection. So here, usually seen in lining of cavities where diffusion of various substances occurs. So when diffusion has to happen through this area, most of the cavities are lined by your simple squamous, okay? For example, you're taking endothelium. So this is your blood vessel, okay? It's been cut open to explain. See, this area is made up of your simple squamous epithelium because diffusion of oxygen, your other iron particles, everything is going to take place through this area. So for the easy passage of material, these are made up of simple squamous epithelium, all right? So this is one more example. So this is your kidney, histology of kidney, and this is your glomerulus. Okay. Glomerulus is seen in what? Center part of the kidney, and this takes place, this helps in filtration. So for filtration to happen, you can see the simple squamous epithelium here. Okay. So the identification points are going to be flattened cells. Yeah, the cells are flattened here with rounded central nucleus. Yeah. Okay. This one. Okay. All these are your simple squamous epithelium. Next is your simple cuboidal epithelium. Yeah, you can see the cells are cube shaped here with nuclei in the center. And here, this is topographical image, and this is one here microscopic textbook image. This is not a microscopic image. This is a textbook image. Okay. So you can see the cube shaped cells with nucleus in the center. Okay. Where they are seen in areas where where there is function of secretion, absorption, like in glands. In case of glands, okay, so it is seen in follicles of thyroid gland, distal convoluted tubules of kidney. You're going to have simple cuboidal epithelium. Okay. So this is one histological image of your simple cuboidal epithelium. Can you see there is a difference between these two? Yeah, there is no distinct cell type, right? There is no distinct outline, but you can see you can compare the cell width and height. Okay. So yeah, this one, okay, here. So this is your simple cuboidal epithelium. Talking about your simple columnar, yeah, the same single layer of cells, but the height of the cell is going to be more than your cell width. Okay, so this is the cells are going to be column shaped. So what is this? Cells that are resembling columns with elongated nuclei or your simple columnar epithelium. So where they are seen, they are basically seen in your GIT, that is gastrointestinal tract, and your uterus. So this is your columnar epithelium. This is your microscopic image. Okay. You can see the columnar cells here. This is a cell outline. And these are your nucleus. Okay. These are your nucleus. Okay. Yeah. Now coming on to the stratifications. So seeing about the stratification, you can see, so this is your basal lamina. Okay. And this is your layers, okay, epithelial layers. Again, this is your basal lamina. Histological image, this one is basal lamina, and these are your epithelial cells. Okay, so where is it seen? These are seen in areas where there is more of protection needed, like linings of your oral cavity, your oral mucous membrane, your esophagus, and your vagina. So all these areas are more prone for infection. Okay, and obviously the epithelial has to play the role of protection. So it has to act as a physical barrier between the external environment. So it is made up of many layers. That's why it is called as stratified squamous epithelium. And they are all obvious. They are exposed to more friction. Okay. And you can have a keratin layer here. You can see the keratin layer here. With this context, there are two types. That is non-keratinized stratified squamous epithelium and keratinized stratified squamous epithelium. So you can see the keratin layers here. So that is why it is called as your stratified squamous epithelium with keratin. Okay. You can see here. So yeah, you can see here. This is the one whole layer of epithelium. Okay, due to many physiological or even pathological reasons, you can have this many layers of epithelium. Okay. Again, this is also a layer of epithelium, like many layers of epithelium. But above this, you'll able to see keratin tissue. Okay. Whereas here, you cannot counteract that keratin layer. Okay. So this is the basic difference between your keratinized and your non-keratinized stratified squamous epithelium. Now, this is your stratified cuboidal epithelium. Okay. Can you see the cuboidal cells arranged in two layers surrounding the duct? This is duct of your salivary glands, excretory ducts, where you can see the two layers of cuboidal epithelium arranged surrounding the duct. So this is your stratified cuboidal epithelium. Now coming on to the pseudostratified. Okay, see, so you can see the stratifications here. Okay, this one, here. Like you can see the multiple nuclei arranged in various heights. Okay, you can see one nucleus here, you can see one nucleus over there, you can see one nucleus here and all. But the main thing is these are all not original stratifications. Okay, this is because there is difference in arrangement of nuclei height. Okay, see in this cell you can see the nuclei is arranged in the middle layer. Whereas here you can see the nuclei arranged in more apical area, that is more front, the basal layer, towards the connective tissue layer. You can see the nuclei is arranged in more deeper, like towards the your free surface. Okay. So there is difference in height of the nuclei arrangement. So because of this, pseudo stratification is exhibited. Okay. Can you see here? So this is original stratification. You can see distinct limitation between two types of epithelial cells. So this is the original stratification, and you can see the level of nuclear arrangement here. Okay. Whereas in pseudo stratification, you can see there is varying heights of nuclear arrangement. See, this is in one whole cell, but the nuclei here is arranged here. And this is your one whole cell, but the nuclear arrangement here is towards the basal lamina. So this height differences of nuclei can mimic it is being stratified. So it is called as pseudo-stratified. Okay. So yeah, with this, your epithelial chapter is coming to an end. So to sum up, there are three types: simple, stratified, and pseudo-stratified. Under simple and stratified, you're going to, depending upon the morphology of cells, you're going to have squamous, cuboidal, and columnar. So your squamous, depending upon the cell width, height, you can just compare all these three types of cells. And each types of epithelium is seen in specific areas to perform specific functions. Okay. Yeah. And now coming on to the connective tissue part. So yeah, connective tissue is basically what? It is basically made up of cells and extracellular matrix. Okay. Okay, first let me just tell what are we are going to see under this. We're going to see about cells, fibers, ground substances, and cartilages. Under cartilage, we're going to see about hyaline, elastic, and fibrocartilage. And under bone, we're going to see about the compact and spongy bone. Okay. So yeah, what is connective tissue? Your connective tissue is basically a group of tissues which connects or binds other tissues in the body. Okay. So connective tissues as such is not a single part. Okay. It is made up of cells and matrices. So you're going to have background. Over the background, you're going to have the cells scattered in the background. Okay. So that background is your matrix. So this background is your matrix, and this matrix is made of ground substances and fibers. Okay. So for example, see, you're going to have, this is, imagine this is your connective tissue. You're going to have matrix. This is your matrix. Okay. And this matrix is formed by your ground substances and fibers. And you're going to have cells within. Okay. Like this. So this is your connective tissue. So we'll see about cells, matrix, ground substances, and fibers each in detail now. Okay. So now coming on to the cells. Cells, you have two types of cells. One is fixed cells. That is, those cells are permanently present in the connective tissue. Okay. Without those cells, there is no connective tissue. Like your fibroblast, your adipocytes, and persistent mesenchymal cells. Your mesenchymal, your fibroblasts will form your collagen fibers. Okay. To give the structural framework of the connective tissue. And adipocytes are your cells which form fat tissues. Okay. So again, adipose tissues, adipocytes, adipose tissue is again a specialized type of connective tissue. So those adipose tissues are formed by your adipocytes. Okay. And persistent mesenchymal cells. So these persistent mesenchymal cells are nothing but they differentiate into fibroblasts and any other type of connective tissue cells to form the matrices. So these are your fixed cells. So you take any connective tissue of that matter, you're going to have this as in standard cells. Wandering cells. Okay. So these are your inflammatory cells, we can say, because in case of any inflammation or any infection or injury, you're going to have these types of cells like your macrophages, your mast cells, your plasma cells, your eosinophils, your neutrophils, and your pigment cells. And now matrix. As I said, matrix is made of ground substances and your fibers. So you can see matrix is your background, right? So this background has to support the cells that is present, right? So to give the support, fibers are there. These fibers will give the structural framework of the connective tissue. But these ground substances are like some, we can say like viscoid, slimy like material that holds the cells together. Okay. It actually holds up the cells. So this is the basic function of your ground substances and fibers. Okay. So again, under ground substances, you have proteoglycans, glycosaminoglycans, your chondroitin sulfate, heparin sulfate, all these comes under your ground substances. And these are your fibers. Under fibers, you have collagen, elastic fibers, and reticular fibers. We'll see about each. Okay, so again, yeah, this is one image of cells of connective tissue where you can see the morphologies. I'll explain in detail. Okay, this is your fibroblast. Okay, so yeah. This is your fibroblast. Okay. So fibroblasts are what? large flat cells with processes. So these are your processes, okay, present in general connective tissue. As I said, it is in fixed cells. It's going to be seen in all types of connective tissue, and they are usually most numerous. So your connective tissue is what? Fibers, more of fibers. Fibers are formed by your fibroblasts. So they're going to be most numerous, and they have these processes that are present in the connective tissue. Okay, this processes. And yeah, fibroblasts migrate to the connective tissue, secreting the fibers and certain components of the ground substances of the extracellular matrix. Yeah, I explained it earlier. I've just explained. Now, coming on to your macrophages. Okay, so these are your macrophages. You can see here one large cell here. This is your macrophage. Okay, and again, can you see why is this large? Because it is just throwing its like it is just phagocytosing. Okay, it's nothing but it's phagocytosing the debris or any infection of that matter that is present. Your macrophage is your phagocytosing cell. Basically, it is in phagocytosis, right? So yeah, these macrophages are developed from monocytes, and they have irregular shape with short branching projections. So these are your short branching projections, and are capable of engulfing any bacteria and cellular debris by phagocytosis. Yeah. There are two types, fixed macrophages and wandering macrophages. Again, like cells in the connective tissue, macrophages are also two types. Okay. Like your fixed macrophages or specific macrophages that are specific for your certain tissues. Like, for example, you have osteoclasts in bone, you have alveolar macrophages in the lung, splenic macrophages in the spleen. You have so many macrophages. Like in the certain tissues, you have specific macrophages. Okay. So those are your fixed macrophages. And next is your wandering macrophages. Yeah. When there is any infection or inflammation, like as sort of chronic infection, your macrophages will come into play and they carry over the healing processes. Okay. Those are your wandering macrophages. But these fixed macrophages are also called as your tissue macrophages. They are very specific. Okay. To certain types of tissues. And this is your plasma cells. You can see these are your plasma cells. There are numerous cells, right, with like eccentrically placed nuclei. So these are your plasma cells. Again, they develop from B lymphocytes. Each of the cells has a separate colony forming unit from which it will just form into immature cells to mature cells to sites to blasts, and then it forms an cells. It forms an matrix. Okay. So yeah, the main function of plasma cell is to secrete antibodies. Yeah, they play a major role in humoral immunity. Okay. So yeah, where they are seen, they are usually seen in salivary glands, lymph nodes, spleen, red bone marrow. Almost most of the areas will have the plasma cells. Okay, so you can see here the nuclei is not centrally placed. It is just pushed towards the corner, like here. Can you see? It is called eccentrically placed nuclei. Okay, one thing you can confuse is you can see of lymphocytes here. Like you can confuse with lymphocytes, but the plasma cells will have the what do we call exact eccentrically placed nuclei. Okay. And yeah, this is your mast cells. Okay. So when there's any infection or any allergy or rashes, you can see mast cells. Okay. So abundant alongside the blood vessels that supply the connective tissue produce histamine. Yeah. In case of rashes, you're going to have mast cells are going to erupt. I mean, they're going to rupture and release histamines, which dilates the small blood vessels as a part of the inflammatory response, so that you get to see redness in the affected area. That is because of your histamine. Okay. So these are your mast cells. Okay. The elongated ones, the elongated, like, can you see a spindle cell, like elongated one? Yeah. These are your mast cells. Okay. Yeah. Okay, so these are all some types of like other cells you see in the connective tissue, like most probably your wandering cells, your inflammatory cells, your eosinophils. You can see the orange colored granules here, and these are your basophils. You can see the blue colored granules here, and these are your neutrophils. One thing you can see between the basophil and the neutrophil is both are multi-lobed. Okay, but the most common is it is basically basophil is basically bilobe, like a spectacle shaped. Okay, your neutrophil is multi-lobed, but then there are certain basophils. See, you can see your three lobes, right? But the major difference is you can see how the cytoplasm is filled with the blue color granules, right? So these are your basophils, whereas you cannot see that in your neutrophils. Yeah, okay. And yeah, again, plasma cells. And this one is your. Okay. So yeah, coming on to the matrix. So I said, as I said, matrix is made of what? Ground substances and your fibers. Your ground substances are your mucopolysaccharides, like your proteoglycans and glycosaminoglycans, your structural glycoproteins, and your water and other electrolytes. So basically, they just hold all the cells which has been dispersed in the connective tissue together. Okay. And fibers they generally give structural framework. That is your collagen, reticular, and your elastic fibers. So coming on to the collagen fibers, your collagen fibers are formed by your fibroblasts. Uh, yeah, fibroblasts. We saw it has an we saw two types of cells, right? Wandering cells and fixed cells. One such your fixed cell was your fibroblast, right? So what is this fibroblast responsible for forming this collagen fibers? Okay, they release tropocollagen. Okay, tropocollagen is something that some sort of protein, like it is basically made of three triple helical. Wait. So it is made of three helical, I mean, three groups of collagen chains which intertwine together to form triple helical structures. Okay, like this. Okay, it forms triple helical structures. In three-dimensional image, you can see this and triple helical structures. Okay, so as they release the tropocollagen will get polymerized to form collagen fibrils. Okay, so these are your collagen fibrils. Okay, so I mean, they do not, these fibrils are called as your microfibrils. Okay. Each one is your microfibril. And these microfibrils will form bundles into, like one microfibril will go join another, one will join another, and it will form bundle. Okay. Each bundle will be formed to present as an collagen fibers. Okay. So they present like in bundles. Okay. Can you see a wavy bundle here? Bundle of collagen fibers. This is one bundle. This is one bundle. Like, yeah, many bundles are seen. Okay, almost 25 types of collagen fibers are seen. Okay, so your collagen fibers are formed like in cartilage. Your chondroblasts will form your collagen fibers. In bone, your osteoblasts will form your collagen fibers. That is your matrix. Okay, in bone, the matrix is formed by your osteoblast. In blood vessels, your matrix is formed by your smooth muscles. In tooth, your matrices are formed by your odontoblasts. Okay, so that is your matrix is nothing but your collagen fibers. Okay, one part of your matrix is your collagen fibers. Yeah. So yeah, the characteristic features, these are white in color. The protein they have within is collagen, and they are non-branching wavy bundle. Yeah. As you can see in this image, you can see in this image, there is no branching. Okay. But they are present in wavy manner. So wavy, non-branching bundles. These are your collagen fibers. Next is your elastin fibers. Okay. Sorry. Okay, these are your elastin fibers. So elastin fibers are basically yellow in color, and the protein they have in here is elastin, where in collagen fibers, the protein is collagen from the name, okay? And here it is elastin. And they present as single fibers, okay? There is, I mean, like, can you see there is no bundles? Can you, here you can see the fibers are arranged in bundles, okay? But here, the fibers are arranged in single manner, but there is branching. Can you see the branching here? Branching, and they anastomose to the nearby fibers, thereby forming a network. Anastomosis, they join the nearby fibers. Okay. So this is your elastin fibers. Next is your reticular fibers. Your reticular fiber is similar to your collagen fibers, like same white in color, arranged in bundles and all. But the main thing is that they branch like other than your elastic fibers. Your elastic fibers will be branching only at some points of end. But whereas your reticular fibers, as you can see, it is full of branches. Okay, it like it branches like something to form an delicate network, but not as your elastic fibers. Okay. So yeah, this is your reticular, elastin, and your collagen fibers. Okay. To how to identify histologically, I'll just show you. Okay. So from the points we have learned, you can say the bundles. Can you see the bundles here? So these are your collagen fibers. Okay. The bundles, the fibers are arranged in bundles. These are your collagen fibers. And can you see the singly arranged fibers here like this? Like this? These are your elastin fibers. Okay. Elastin fibers. So this is how you identify histologically both the collagen and your elastin fibers. And you can see the reticular fibers in the background. Minimally, like they're immature. Can you see here? This one, this one, this one, this one. All these are your reticular fibers. And these bundles are your collagen fibers. The fibers that are singly arranged are your elastic fibers. Now, okay. Coming on to the cartilage. So see, as far as your movements or locomotion of human body is concerned, it's always about the bone and the joints. Okay. But one most important thing that for the bone or joint to function is cartilage. Okay. So for example, if you take a TM joint, like temporomandibular joint, imagine this is your articular fossa and this is your articular disc. Okay. Your articular fossa and disc has to come in contact so that you can open and close your mouth. Okay. Like it produces the movement. For that, like two hard substances, when they just come in direct contact, there is obviously going to be some sort of friction, right? So to prevent that, we're going to have a capsule, that is a gel, like, or in a native language, or most of in layman term, they say jav, right? So that is nothing but your cartilage. Okay. So cartilage is something called what? When there is any two hard substance, like hard tissue, like your bone joints, when there's any bone joints that has to articulate to perform the action. So to do that articulation, you're going to have cartilage as an protection layer, just to just to make sure that this articulating process happens in a smooth gliding point. Okay. Like, yeah, like when the missions rupture together, to prevent the spark of any heat or fire, we just pour some sort of oil, right, to like to happen the process very smoothly without any friction or any heat production. So like such, you have this cartilages. So yeah, again, this is also when connective tissue. Okay. So cartilage is a type of connective tissue produced by the special cells named chondroplasts that are sparsely distributed in an extracellular matrix containing collagen, proteoglycans, glycosaminoglycans, and in some cases, small quantities of elastin. Okay. So, yeah, what cartilage is and connective tissue? The cell here is your chondroblast. And your ground substance, that is your matrix is going to be a ground substances. Under ground substances, you're going to have your proteoglycans, your glycosaminoglycans, and your fibers are your elastin fibers and your collagen fibers. So that is your cartilage. So it is seen in, yeah, as I said, joints of the skeleton, ears, and the respiratory tract. Okay. Yes, so for example, if you just bend your ears, can you see this is your cartilage? If you just bend or just revert, if you just pull your ears, it is going to revert back to its original shape. It is because of the function of your elastin, that is sort of your cartilage. Okay, so it has no blood or nerve supply, and the essential substance here is through passive diffusion. That is, the nutrition for this cartilage is supplied through passive diffusion, not through any direct blood supply or nerve supply. And one more thing, in the starting, I told that epithelium also has no blood or nerve supply. Okay. So histologically, there are three types of cartilage where you can see hyaline, elastic, and your fibrocartilage. Okay. We'll see about each. So yeah, this is your hyaline cartilage. Okay. Okay, so hyaline cartilage is the most common type of cartilage that is seen in the human body. And hyali, that is, it is derived from the Greek word called glass, okay, meaning the cartilage is transparent, okay. So it can be found in skeletal joints, part of the nose, cavities of the larynx, and the tracheal rings. So you will have questions like, where do we see the hyaline cartilages? Okay. For that, you can remember it as blanket. Okay. Like to remember, I'm just giving a mnemonic called blanket. Just spell it as CET, not KET. Okay. Your bronchial cartilage, your laryngeal cartilage, your articular cartilage, your nasal cartilage, the costal cartilage, epiphyseal growth plates, and your tracheal cartilages. Okay. So you can remember the mnemonic as blanket and can just memorize that where all these hyaline cartilages are seen. Okay. Yeah. So from this image, you can see any cartilage of that matter, it is going to be surrounded by your connective tissue. This is your connective tissue. Okay. Like dense, irregular connective tissue. There is haphazard arrangement of this fibers, right? So it is an irregular connective tissue. And you can see these are all your chondroblasts. Okay, these cells, the blue ones are your chondroblasts. Okay. Now, where is extracellular matrix? The background. This is your extracellular matrix. This pale pink areas are your extracellular matrix. Okay. And this is your chondroblasts. Okay. These are all your fully formed mature chondroblasts that are laying down the extracellular matrix. And these are your chondrocytes. Okay. These are your chondrocytes. They are just developing into like nothing but immature chondroblasts that are developing into chondroblasts to form an extracellular matrix. So the chondrocytes are going to get mature into chondroblasts and they just lay down the matrix. This is the basic concept behind this. Okay. Yeah. Now moving on to elastic cartilage. So coming on to the elastic cartilage, your elastic cartilage is again similar to your hyaline cartilage. Okay. Same like as you see in the image, the same is your elastic cartilage. Just chuck the color because it is not the eosin and hematoxylin stain. This is some other stain. But yeah, Toledan blue stain. It's not in the curriculum. Just leave that. I just got this picture in the image, so I'm just giving. So yeah. So yeah, it is same as your hyaline cartilage. Okay, but the major difference is they have abundance of elastin fibers in the extracellular matrix, giving it a rougher structure. So like, can you see the extracellular matrix here? It's very rough, right? Like, can you see can you see it here? It's very smooth and it has a dense, smooth manner. Whereas you can see there is haphazard arrangement of fibers here. Okay, like can you see here? There is smooth branching here. Okay. This is because of your elastin fibers here, here, here. All these, this empty spaces are your territorial matrix. That is your surrounding your chondroblasts. Okay. Just leave that. I'm just asking you to see the extracellular matrix here. Can you see how rough it is? Can you compare it with this? It is very smooth here. Whereas it is very rough here. This is because of your elastin fibers. So that is the reason it giving it a rough appearance. So yeah, it is found in the outer ear and epiglottis. So you can just memorize it as ACE. You can remember the mnemonic as ACE. So it is seen in auricle, auditory tube, cuneiform cartilage that is in your larynx, and epiglottis and external auditory meatus. So you can just remember it as E for E. So ACE. Okay. Next is your fibrocartilage, the third type. So as you can see in the image, the fibrocartilage is more of fibers, more packed with fibers than the chondroblast. The chondroblast and chondrocytes are very sparsely seen, right? So the fibrocartilage, your fibrous extracellular matrix, okay? So it is mostly made of type 1 and type 2 collagen with chondroblast sparsely distributed in it. So it is mechanically the strongest type of cartilage. Yeah, it's very obvious because it is made of so much of fibers. It is the most strongest cartilage and it is most commonly seen in meniscus of the knee, the intervertebral discs, and junctions of tendons with muscles. So most of the weight-bearing areas of the body will be made of this fibrocartilage. Okay, now moving on to the next topic, that is your bone. With this, the class will get over. So the bone is the last topic. Okay. So coming on to the bone. So yeah, as we all know, bone is also called as your osseous tissue, is the firmest and the most dense type of connective tissue. So again, this bone is also a type of connective tissue. Okay, so it is made of two types, like two types of bone are seen. That is your compact bone and your spongy bone. See, for example, imagine like this is your long bone. I'm just giving an example of long bone. So your spongy bone is seen in the medullary area, that is in the central part. Okay, in your marrow area, that is your spongy bone. Your compact bone is seen in the outer layer. I mean, in the peripheral areas. Okay, in the peripheral areas. So these are your compact bone. This part is maximized here, and this part is maximized here. Okay, so yeah. So you're talking about your bones. So there are two types of bone. One is your spongy bone and your compact bone. Your extracellular matrix here is ossin. Ossin is a type of protein which is seen in the bone. So bone will have ossin, whereas your cartilages and all had what? Elastin, collagen as your extracellular matrix. But in bone, you're going to have ossin as an extracellular matrix and a small quantity of hydroxyapatite. So yeah, it is hydroxyapatite is in combination of calcium, phosphate, and your magnesium ions. So these are nothing but your extracellular matrix as such is in combination of inorganic and organic material. Okay, organic is your is your protein, ostin. Inorganic is your all these ions. Okay, so yeah, starting off with the compact bone, as you have nephron as a functional unit for kidney, you have neuron as a functional unit for brain. Osteon is a functional unit for your compact bone. Okay, not for your spongy bone. Just remove the spongy bone now. As of now, let's concentrate on the compact bone. Osteon is your functional unit. Okay, many number of osteons will. This is just in gross picture of your compact bone and your spongy bone. It's also called as your cancellous bone. Okay, so yeah, as I said, the outer layer of skeletal bones are composed of compact bone tissue covered by periosteum. Okay, so the outer layer is your compact bone, and this outer layer is covered by connective tissue, right? So any connective tissue of that, sorry, anything of that matter is going to surrounded by a layer. Like how do we have dense irregular connective tissue in the cartilage, hyaline cartilage I showed image, right? So like that in bone you're going to have periosteum. Okay, so yeah, this compact bone is formed by smaller functional units called osteons. So osteons are nothing but it is composed of different types of cell with different functions, like your osteoblasts, your osteoclasts, and your osteocytes are seen. Okay, osteoblasts are nothing but your bone forming cells. Your osteoclasts are your bone bridge cells. We'll see about that in the upcoming slides. Your circular structures are seen in their osteons. Okay, so can you see the circular structures? So this has been maximized here. Can you see the circular structures? So these are your canaliculi. Okay, sorry. Hmm. So these are your osteocytes, and these are your small concentric rings. That is your canaliculi. Okay. So can you see the Hawaiian canal here? So this is your Hawaiian canal. This is nothing but you have your blood supply and nerve supply of the bone in the Hawaiian canal. And from this you have Workman's canal. That is a perpendicular canal will be seen from this Hawaiian canal. And this Workman's canal is for passage of nutrition. Nutritions for this bone is supplied through this Workman's canal. Workman canal will be seen somewhere here. Okay. Yeah. And this is your, yeah, the osteocytes. Osteocytes. You can see the extracellular matrix here. So yeah, histologically, your central part of osteon, this is your osteon. So see, this is your osteon. Can you see the concentric rings here? Yeah. Can you see this? This lines, these are your concentric rings. That is your lamelles. Your concentric rings are nothing but your lamelles. Okay. And the center, can you see the Hawaiian canal, like where we had the blood vessels and nerve supply in the that image? This is your histological image. This is your Hawaiian canals. The hollow canal is your Hawaiian canal. You have your blood vessels, lymph vessels, and nerve pass through the canals. Okay. So this is your osteon. Osteon, single. This is one osteon. This is one osteon. And this is one osteon. So everything you can see here is in circular structures, like bundles you can see. Okay. Now coming on to the spongy bone. Okay. So the main difference between your spongy and the compact bone is compact bone, can you see how dense it is? The extracellular matrix is so dense and smooth. But here, can you see how porous it is? It is made of many cavities like this. All these are your cavities. Okay. Only this is your bony trabeculae. This is your bone. This is your bony trabeculae. All these spaces are nothing but the initial thing we saw, no, like the spongy bone, like it was mimicking your cheese pattern or honeycomb pattern. Like what do we call the holes? Okay, so those are your these cavities. Okay, and this is your trabeculae. That is your bony trabeculae. Okay, your bony trabeculae is usually irregular and thin shape, whereas here you can see it is very dense here. Okay. And you can see the osteocytes here, and you can see the bone matrix. This is your bone matrix. The lamellae, that is your lamellae are not arranged in concentric rings here, where you can see the lamellae are arranged in concentric ring here, right? Here you can see the lamellae are arranged perpendicular in the perpendicular manner to the trabeculars. Okay. And this is your osteoclast. Yeah. Can you see the osteoclast? It has it shows projections here, and you can see the osteoblast here. Osteoclast will show projections like this. Okay, but your osteoblasts are round, just round shape. And these are your red bone marrows. These space is your red bone marrow. It's nothing but hematopoiesis, like your blood cells. Your blood cell formation will happen through this red bone marrow. This is a major difference between your compact and your spongy bone. Okay. So to sum up, how to identify whether the bone is spongy or compact, you have to first look up for your osteons. Osteons are nothing but your functional unit of the compact bone, where your spongy bone does not possess any osteons. Okay. This is your osteons. Okay. This is one osteon. It's another osteon. Okay. So you check for osteons and the overall texture. As I said, so as I said, the texture here is dense and smooth, whereas texture here is what? More porous. Okay. Arrangement of lamellae. Yeah, as I said, the lamellae are arranged in concentric circles. Okay. This one line. Can you see the circles? Yeah. And here the lamellae are arranged in perpendicular manner. Parallel to your trabeculae. Marrow spaces. Yeah, you have marrow spaces. Red bone marrow spaces are most commonly seen only in your spongy bone, whereas your compact bone doesn't exhibit this red bone marrow spaces. Okay, all these are your red bone marrow spaces. So this is how you identify your spongy bone and your compact bone. Okay, this is one, to give a clear image of osteoblast and osteoclast, I've added this image. Yeah, these are all your osteoblasts. Okay, osteoblasts. Can you see here? And these are your osteocytes. Your osteocytes are nothing but these osteocytes are going to form the bone. They just exhibit, they lay down the matrix. Okay. Your osteoblasts will form new bone. Okay. Okay. So these are your osteoclasts. Okay. Osteoclasts. Can you see multiple nucleus is seen? 1, 2, 3, 4, 5. Multiple nucleus. This is your osteoclast. Okay. Okay. So this is basically like osteoclast and osteoblast will have to work together, okay, to form the bone and to resorb the bone. In other words, to maintain the bone homeostasis, osteoblast as such cannot form bones, and osteoclast as such separately cannot resorb bone. Okay, your osteoclast has to release your transforming growth factor beta and interferon growth factor to induce signals for osteoblast to lay down the new bone. And in turn, this osteoblast will form rankle and other integrated growth factors. Wingless integrated growth factor, all these growth factors will be released by your osteoblast to induce the osteoclast to resorb. See, you can see multiple nucleus are seen in osteoclast, and they have finger-like projections. Okay, so these finger-like projections will go and resorb the bone by releasing certain molecules here. Okay. And these osteoclast and osteoblast connection is laid down by certain types of signals like FAS ligand. Like this ligand and protein is your lock and key manner, like where FAS ligand like key will be present in the osteoblast and lock will be seen in the osteoclast, so that they just join together like this and they perform the action to maintain the bone homeostasis. Okay. So with this, I'm concluding. Hope you all are clear with the class. Is there any doubt? Like, if you have any doubts, you can ask. Or was the class so extensive, or can you be, were you all able to like take up, or is there any corrections I can make? Okay. Hope the class is understandable. Okay. Thank you.